In a hospital, healthcare until the clock runs out. A 37-year-old man was admitted to a hospital several months ago with seizures. His MRI was frightening, showing a brain full of holes. Medication controlled the seizures, but the drugs were just band-aids on a big, undiagnosed problem. The patient was not particularly alarmed, which in itself was fairly alarming. His brain was riddled with infection or tumor, but all he wanted to do was get out of the hospital and go back to his life. By all accounts, it was a troubled, isolated, drug-ridden existence in a flea-bag hotel, a life free from anything resembling regular medical care. Still, he was ready to be on his way. The only way to diagnose his problem was a brain biopsy. Anything to get out of here, the patient said, and signed a consent form. The biopsy was performed uneventfully, and small specimens of the abnormal tissue were sent to the lab for a diagnosis. That was on a Friday. By Monday, everyone was ready for an answer. By Tuesday, it was hard to tell who was more impatient, the patient pacing the hallways or his doctors pestering the lab. On Wednesday, with the specimens still being processed and another weekend looming, the case had attracted the notice of the administrators known in hospital vernacular as the discharge police. Within minutes, it seemed, the patient was out of that expensive acute care bed and on his way to the subway, clutching a thick sheaf of instructions, appointment slips and prescriptions, still without a diagnosis, brain full of holes, but free at last. Your reaction to this story will almost certainly depend on your understanding of the word hospital. The word has connotations of care and comfort dating to the Middle Ages, but its meaning is changing so quickly that even the people who work in one cannot agree on what it is. Once hospitals were where you found a doctor when you suddenly needed one, now doctors are all over the place, from big box stores to storefront clinics. Hospitals were where you were headed if you were very sick, now you can heed your insurer's pleas and choose a cheaper emergency center instead. Hospitals were where you stayed when you were too sick to survive at home, now you go home anyway, cobbling together your own nursing services from friends, relatives and drop-in professionals. Once hospitals were where you were kept if you were a danger to yourself or others. They still serve this function, although, perhaps, the standards for predicting these dire outcomes have tightened up quite a bit.